Welcome back. This is part two, people. So, if you've watched part one, you already know what's going on. You know, you know I've been through a lot, and honestly, part one was just a warm up, like warm up. So, not long after the gastroscopy came my first clinical placement, and it was 1 month, like 1 full month. And it was so exhausting, like very, very exhausting. And it's not even because taking care of clients was difficult. I have experience in that. You know, I've worked in the hospital in Nigeria, so I have experience in caring for clients, caring for patients. So, like, whichever one you choose to call it, I have experience in that. But taking care of them was not the issue. The issue was the brain work that was involved in taking care of them. Like, my brain was working overtime. Like, and mind you, I was already having migraine. So, like, my migraine experience already from medication and all of that, I'm already having migraine. So, like, the whole issue was the language. Finnish language. I know people have different experience when it comes to Finnish language, but for me, it has been tough, like very, very tough. One moment I think, oh, I know things in Finnish. I know things in Finnish. And then you go out there and they are just, they will say one sentence, they will say one wrong sentence, and the only thing you can pick is one thing, just one. So, like, my brain was working very, very hard, very, very fast. Because Finnish language, they have written Finnish, they have spoken Finnish. The same way we have normal English and pidgin, you know. But then, if you hear pidgin or broken English, you can still relate it to the normal English, like proper spoken English. But Finnish spoken and Finnish written, they are like this. And Finnish people talk so fast. So somebody can say like 10 words and I'm picking only like one or two or three, like so my brain have to work so fast to piece the things I've gotten, the things I picked, like piece it together, like, okay, what the person trying to say, what the person trying to say. So my brain was working over time. And that was what made the whole experience exhausting. Very, very exhausting. I was one of the lucky people in my class that their supervisor spoke English. So my supervisor spoke English to me. And once in a while, they put in Finnish. So I get familiar with Finnish as well. And sometimes they'll just speak simple Finnish for me. And they'll be watching me. Is she picking it? Does she understand what I'm saying? But then, based on my experience in care already, and according to my supervisor, she's smart. She used initiative. That was what my supervisor said. Because they know I don't understand what they just said. But for some reason, I am doing what they told me to do. So, like, I just put in initiative, like, okay, we do this at this time, do that at this time, we do this at this time, do that. And then when they say something, I'm like, okay, I think this is what the patient needs. This is what I'm supposed to do. And I just found myself doing it. So it's not as if I understood what was said. No, I did not understand what they told me. I just used my head, put two and two together, like, this should be what they are asking me. But sometimes, if I'm not sure, I still ask. And when I ask, they tell me, this is it. And sometimes I just guess and they're like, yeah, you're right. This is what I asked you to do. So, like, I was, my supervisor spoke English to me, but the resident, because my first placement was in the home care. So, like, the residents, the clients, they spoke only Finnish. Only Finnish. So, and they understand only Finnish. So that was a lot. My brain was just doing gymnastics, somersault, boxing. Like every day I go home, I am exhausted. I am drained. I am drained because my head, that period saved, like I ate I ate a lot because my brain needs food. My brain needs food. I was always eating yogurt and granola, and then my normal lunch. On a normal day, I don't snack. It's very hard for me to snack. Even fruit safe, it is hard for me to just snack. Biscuits, pastry, it is very, very difficult. But that period, I had to snack. Like, I had to eat snacks. Like, my brain needed food, serious food. And of course, there will be no clip of the experience because confidentiality, for confidentiality reasons. In fact, even there, you are not allowed to snap the client, you're not allowed to video. I was allowed to go in with my phone. Ideally, I'm not supposed to, but because they know I'm an international student and communication and everything is hard, I'm allowed to go with my phone and I can just, okay, what is this? Okay, and then I will say the word and finish. And sometimes the residents will understand me and do exactly like what I said. And sometimes they'll just be looking at me like, Lisa, Lisa, Lisa. And I'll be like, Odota. Odota is wait. I was like, and I'll run, go and look for my supervisor and tell her to come. So she'll be the one to talk to the clients. Like that experience was my brain was braining. It was braining. So with everything that I had to go through in that experience, my migraine got worse. So I had to go see my school doctor. I booked an appointment, went to see him. And I told him about the constant headache, ibuprofen, paracetamol, like the over-the-counter drugs. The one I had was not working. It was not working, so he told me to get a migraine medication. So that one I didn't. I got a prescription from him. Yeah, I need to get prescription for migraine medication. Yes. So I got a prescription for him, and then I went to get it from the pharmacy. So I took the migraine medication. The first day, like the first tablet I took, the headache just disappeared. It ceased immediately, instantly, and I'm like, oh, thank you, Jesus. Oh. I was so happy. I was so happy. But then that very same day, my chest started hurting, like my chest. When I breathed in, the pain was worse. So like I was even scared to breathe. So I called the helpline. I called them, told them I took this medication and this is how I feel at the moment. And they were like, don't worry, it will soon pass. Maybe a side effect. It's your first time taking it and you just took only one. So don't take it again, but over time it will pass. That's what I was told. So I reported and they told me, don't worry, you'll be fine. But on day 3, normally when somebody has side effect and you stop taking the medication, it's supposed to like reduce. But mine was increasing. And mind you, I did not take the medication again. No. The first day, that was the only thing I took. The headache stopped, like it stopped. But the pain I was having in my chest, it felt like it was my lungs. It felt like it was in my lungs I was having the pain. The pain was there. It was increasing and increasing and increasing. So on day 3, I could hardly breathe. Like I could not breathe. I could not breathe at all. So we had to call paramedics. We had to call the emergency line, and paramedics came to my house. That moment, I was just like, God, I beg. Lord, I commit myself into your hands. It was a horrible experience. Like, now I can laugh about it. Yes, I can laugh about it now. But that time, it was not something to laugh about. Like, my husband was scared for me. And I just thank God that when that whole incident was happening, my son was sleeping. So thank God he did not see me in such a state, because the last thing I want is to traumatize my own kid. Like, no, I don't want that. I don't want that. So like I could barely stand upright. I could barely lie. Like if I even lie down safe, the pain was worst. So I could not even lie down. So paramedics came home, they did their own investigation, and then I had to go to the hospital. So in that period, I don't even know I have phone to be saying, "Oh, I'm having chest pain. I'm going to the hospital. The paramedics are here. See the paramedic." No, 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 no. There's no time for that. Like, if I can fling my phone, I'll fling it. There's no time for that. I don't have time to be videoing my experience. Like, who does that? Even people say that come to internet and be crying. I'm like, you have time to set camera and be crying. Like, he never paying you yet. But anyway, everybody with their own experience. Well, some people they just set camera, talk, and then tears, no problem. But you are in pain, you are crying, you not set camera. No, now does not make sense. Anyway, I was having that pain. Paramedics came over, and I had to go to the hospital, to the emergency side. So I had X-ray done. I had CT scan done, blood tests, and everything else. And guess what? They found nothing. Nothing. Nothing was found. With the pain I was having, every X-ray, CT, there was nothing. That's my first time having a CT scan. First time. The thing they even injected into me safe, like the heat. I felt the heat flowed everywhere. In fact, safe, my pubic area felt it the most. I don't know what they gave me, but after everything, nothing was found. Make it make sense. They did not find anything. And guess what? The pain just stopped. Like it never existed to even begin with. It just disappeared. So now if I'm even trying to tell the doctor, where's the evidence? Where's the evidence? 3 days of pain that I was holding my breath, because if I breathed in, the pain was only for it to just. And then why didn't the pain even just before paramedics came, before they took me, before I went to the hospital, before I enter X-ray, enter CT? It did not disappear till we've gone through everything.
I had to record this as evidence because if I told the story later, people might think I was exaggerating. After everything I went through, they found absolutely nothing. I thank God but I couldn't help wondering, where did all that pain come from?
We are still waiting. Oh. I not receive bill, but okay, I received bill for only paramedic visits. But CT, X-ray, I not receive any bill. I'm still wait. I see I'm still keeping my eye on mail too. But they me surprise. Come and pay. So like we paid for the paramedic visit, but I don't know if there's another bill waiting. I don't even know safe. But so far so good. There's no bill, so thank God. The one we got, we paid for it. So thank God it was not that, because my mind was this whole experience. I'm not going through school or anything, because through school things are free as a student. But this was me calling the emergency line directly, like this is what I'm going through, and then it came. So I was thinking the bill was going to be like, but thank God it was not high. It was not high. Just leave it at that. It was not high. But anyway, if you've not subscribed to my channel, please subscribe to my channel. Subscribe to my channel. Now is probably a good time to just click that subscribe button. Thank you so much. Thank you so much. So, but honestly, my life seems to be coming with free plot twists, So subscribe and join us for more real student mom life in Finland. So subscribe to my channel, bestie, and like the video if you've enjoyed it so far. If you've enjoyed my life story so far, like the video, subscribe to my channel. Thank you so much. God bless you. Thank you for subscribing to my channel. Thank you for liking my video. I think that was not enough. Gist still there, gist still there. I think that was not enough. School came with its own, his own boba, and said, "It is my turn. It is my turn." So school stress started. Clinicals was on his own. Clinicals have come and passed. Now school, we have come back to school after clinical placements. School now say, "It's my turn. It's my turn to stress you." Yes, it's my turn. So we had exams back to back. I had more than 10 exams. Yeah, more than 10. In a short period of time, I had more than 10 exams back to back. And some of the exams was still under one course. Like one course had multiple exams. Multiple under one course. And that same course still had practical exam. Imagine doing a course and you're writing 5 exams, midterm exam under that course. You still have practical exam under that same course. Then you still have another basic general one under that same course again. One course, so other courses still have their own exams. So like I wrote more than 10 exams, more than. Some of them I passed. Some I failed. Yes, I failed some of my exams. I did. But, the ones I failed, I had to resit them immediately. I received them immediately, and the second time I passed. So it was very, very necessary. Very, very necessary, because the pressure is real and the goal is real. The goal is to get more than 60 credits. If you get more than 60 credits, you are getting reduced tuition fee. So the goal is real. Yes. The goal was more important than the stress, more important than the failure. So I had to go and resit those courses, those exams immediately. And I passed the second time. So, and I beat that expected credit. And my tuition was sliced in half. Yes. Yes. Victory was mine. I'm just so glad, like, you should see me tensed and worried that period because, like, hey, my mind was just, God, I beg. God, I beg. Even if the money is there to pay the complete tuition, that doesn't mean I want to pay the complete tuition. No. When there is an option for me to pay half of the tuition, I think I'll go for complete. No, I better go. I like a wolf. Me, I like a wolf. Yes, I like discounts. I like discounts. And I'm proud. I will say with my full chest. I like a wolf. So the goal is more important. I have to sit down, read. And the migraine came back, but me, I'm not taking any chances to go and start taking another medication again. Do I start doing experiments again? No. The doctor was like, you can try another migraine medication. Maybe that one you took was not for you. But I don't have mind to try again. I don't. So I have to sit through the migraine, read, write the exam. So that was what happened. So, and after everything, like the pain, the placement, the emergency room, the exams, I finished with more than 60 credits. So, hooray! Honestly, I'm proud of myself. Even with everything happening at that time in my life, I was able to be victorious. And for sure, with God on my side, because I did not do it on my own. I did not do it on my own. God helped me with everything. On my own, I would just fall on my face, like my face. But God helped me throughout everything. Like, it was not easy, but I'm proud I got to where I am. So if you've been wondering where I've been, now you know. Now you know where I have been. So life was truly lifing, but we are back stronger and a little wiser. Yes, I'm now wiser. Ask me anything, I know it. Oh God, just kidding, but I'm a little wiser now. So hopefully with everything, I'm going to get fewer hospital visits because, as you know, I still have pending lab investigation to still go on to know if those medications for the Helicobacter pylori, if they worked or not. So hopefully I pray for fewer hospital visits, and also I pray that with this final investigation, final medication, my pain will be gone completely, and I'm not going to experience that again. And I will never wish for anybody to go through the pain or the things I went through. Like, honestly, it's not something to wish anybody, even if it's your enemy. It's not something to wish they had. So thank you for being here and listening to my story. Thank you so much. I'm so glad you actually listened. So I'll see you in the next video. Bye. Thank you.